Patient number 18. Ma'am, patient number 18.
Ay, ma'am.
Sige. Palihog lang po, ma'am. Number 18, ma'am, no? Okay. Proceed lang ta sa room 8, ma'am. Ma'am, okay. Instruct ka ha. Kusa pa, ma'am. So, ma'am, makasabot ba kang Bisaya, ma'am, or English? Sa may preference din mo, ma'am, na language?
Bisaya o English, ma'am, pwede.
Sige. I have few questions, ma'am, ha? Mga po yung mga pangutana. What's yung pangalan na to, ma'am?
Nikki Reyes.
Nikki Reyes. Ang age, ma'am?
21.
21. Ano sa'yo birthday na to, ma'am?
March 2, 1999.
Ma'am, mangutana ko, kano sa kalas idugog, ma'am?
Last week pa man.
Last week. Okay. Tapos, wala ba kay mga procedure na x-ray, mga kagong year, ma'am?
Wala.
Wala. Sige. Ma'am, mga, call ko o request ni Doc, ang x-ray request ni Doc.
Ay, kanay ma'am ko.
Sige. So, sa femur. Ngano di ay, ma'am? Naunsa di ay ka, ma'am?
Anong na-slide, mang good ko. Tapos, basta nagsakit ako ang mukhaan, dili dapit o.
Sige. Ma'am, ha? Ani, ma'am, i-instruct ka, mag-change ka o patient gown na atay dressing room dito dapita, tapos tanggalon na to ta ng jewelries, tapos other metallic objects, ma'am, ha? Tapos balik ka lang ka there kay mag-start ta sa procedure.
Sige.
Thank you. So, for our procedure this afternoon, we are going to conduct a AP projection of the femur. So, for the femur, we are going to use 14 by 17 inches of IR size, which will be put in the table, nakaset. So, it will be located here, assuming that this is a radiographic table. So, the first procedure will be AP projection of the femur. Ma'am, proceed lang tayo, ma'am. So, the patient will be in a supine recumbent or higda atong patient. So, ma'am, magunit ko, ma'am, ha. Higda lang sa ka, ma'am. Anak. So, baba tagamay, ma'am. So, relax lang sa ata, ma'am. So, for the patient comfort, you have to put a pillow para dili maglisod ato ang patient. So, for the position the patient to align the femur kani to the midline of the IR. So, make sure nga ang patient na to kay nasa midline. So, ma'am, sibukan dali, ma'am. Sige pa, ma'am. Kaya pa niyo po, ma'am. Sibog. So, kana. Assuming that the patient is now at the midline of the table, which is perpendicular to the IR. So, straight lang, ma'am. Relax lang ta, ma'am, ha? And then, do not forget to internally rotate the leg of the patient 5 degrees to achieve the true AP projection. So, ma'am, rotate na to gamay. Ang tiil. So, internally rotate the leg of the patient 5 degrees. Do not forget to internally rotate. So, it is done. Then, in positioning the patient, make sure that the knee joints and the femoral joints will be included in the IR by considering the divergence of the X-ray beam. So, since our knee joint and the femoral joint is now perpendicular to the IR, the central ray will be perpendicular to the femur and to the IR. So, kani, ang femur o ang IR will be perpendicular sa ato ang central ray. It should be directed to midpoint of the IR. So, make sure na ang femur and IR kay perpendicular sa part of the IR. So, do not forget to put gonadal shielding to the reproductive organ of the patient. So, ma'am, nagbutang po for the collimation. Make sure to include only the anatomy of interest. So, collimate on the four sides of the anatomic part and make sure that the knee joint, which is here, and the femoral joint will be included. So, mag-collimate ko, ma'am, ha? So, the central ray will be at the midpoint of the IR, perpendicular to the femoral bone. So, kana. So, since our shielding is already positioned, do not forget to put the marker on the lateral side of the anatomy. Make sure that it will not obstruct the anatomy of interest. So, ma'am, ayaw lang talihok, instruct the patient to do not make unnecessary movement during the procedure. So, ma'am, ayaw lang talihok. And 3, 2, 1, shoot! So, for the anatomy demonstrated, we have here the femur. So, this is the femoral bone. And we have here the lateral epicondyle and the medial epicondyle. Then, we have here the knee joints along with the proximal end of the tibia and a little superimposition of the fibula here. So, the knee joints will not appear fully open because of the divergent of the X-ray beam. So, no rotation is evident because the femoral and tibial condyles should appear symmetric in size and shape. So, the femoral condyles appear symmetric, and the approximate medial half of fibular head should be superimposed by the tibia. So here it was superimposed by the tibia. Then the femur should be centered to collimation field and aligned with long axis of the IR with knee joint space a minimum of 1 inch. So no motion occurred because there's a fine trabecular markings on the image, and it appeared clear and sharp throughout the length of the femur. So for our next procedure, we are going to perform a lateral projection. This projection, the IR size will be the same. It will be 14 by 17 inches with an minimum SID of 40 inches. Then it will be lengthwise also. So the cassette or the IR is already placed, and the patient will be for the patient position. Ask the patient to do the lateral recumbent position with the affected side down. So instruct the patient to do so and assist if necessary. So ma'am, position ta ma'am ha. So rotate lang kada gigamay ma'am. Kaya ba nimo ma'am? So kana. So kana, ma'am, kana lang. So ana. So iana lang nimo na imong ma'am para dili ka maglisod ma'am. So kana. Then for trauma patient, it will be unnecessary to do this because it will be stressful for the patient. So supine will be okay. And also, you have to use pillow for patient comfort. Ask the patient to flex her affected knees in a 45-degree angle and to place the unaffected one behind that affected leg to prevent over-rotation. So, ma'am, i-flex lang nato atong knee 45 degrees. Tapos, the unaffected one behind the leg for the support and to avoid over-rotation. Then, make sure that the femur will be perpendicular or at the center of the table. So, the femur is now at the center of the table and it is perpendicular to the IR. So, for the central ray, it should be perpendicular to the femur and to the IR, which will be directed to the midpoint of the IR. So this is the midpoint of the IR, so the central ray will be here. It will be here. Then, make sure that the femur was aligned at the center of the table and is perpendicular to the IR. If not, you have to adjust. So, ma'am, adjust to diri gamay, ma'am. O na. Then, forget to put the gonadal shielding, ma'am. Magbutang ko, ma'am, ha, at the reproductive organ of the patient. So, for the collimation, make sure that you will collimate closely both side of the femur with end collimations to the IR borders. So, ang the central ray should be perpendicular to the IR. Then, it will be directed to the midpoint of the IR also. So, the femur was aligned. Then, the collimation is done. So, ask the patient to not make unnecessary movement. Then, do not forget to put the marker. Then, ask the patient to not make unnecessary movement. Ma'am, mag-shoot na ko, ma'am, ha? And 3, 2, 1. So, for the anatomy demonstrated, here, we have in a lateral-medial projection of the femur, we have here the femoral bone, which is here. Optimal exposure with correct use of anode heel effect resulted in a near uniform density of the entire femur, and no motion is present because there is a fine trabecular markings and clear and sharp throughout the length of the femur. Then we have here the overlapping of the tibia to the fibula, or there is a superimposition, and we have here the knee joint. Then the knee joint will not appear open, and the distal margins of the femoral condyles will not be superimposed because of the divergence of the X-ray beam. So, the femoral condyles will not be superimposed here. Then, it is a true lateral because the anterior and posterior margins, which is here and here, of the medial and lateral femoral condyles was superimposed and aligned with open femoropatellar joint space. So, it is here, it is an open femoropatellar space. Then, there is a minimal collimation borders with the proximal and distal margins of the IR, which is here and here. Then, for the exposure criteria, the optimal exposure with correct use of anode heel effect, as what I have said, it has almost a uniform density, and no motion is present because there's a fine trabecular markings, and that's it. Sir, tapos na po tayo sa procedure natin ngayon. So, pwede ka na po magbihis doon, sir, sa bisanan natin, sir, para balik ka dito sa akin, tapos instructionan kita regarding sa result mo, sir, ha? Na?
Yan na go.
Oh. So, sir, tapos na tayo na, sir. Salamat ka. Salamat po. Tapos, sir, balik ka dito after 2 to 3 hours po para kunin yung result mo, sir. Tapos, pakita mo lang yung resibo mo, sir. Opo. Salamat, sir. Sige po, ingat po.